absorbs in the mineral. And of course, I think a lot of us are aware of that. Most of it probably have some quite a bit of alcohol last night, except me, I wasn't there. Okay. First of all, I would like to introduce myself. I'm a chiropractor. I've been in practice for 20 years. And during the course of my practice, I'm not just focused on the pain, but I like to change the person's functionally from outside and inside. And in order to do that, we need to really look beyond just the physical pain or motion component, but actually be able to utilize mineral, nutrient, vitamins to help the body to heal. And actually, it does take quite a bit of time to do that. Based on my information and all the people research, I found that it takes at least a year to 2 years to be able to change the structure inside the joint. And there are some studies done on when people take certain kind of new supplement, for say like glucose, control sulfates, and things like that. And a lot of older folks, they took supplement, but they don't do anything to open up the space in the joint. So that's something that's important to do. The reason I say this because that there's some relationship between this and the product we use, Seacret. So in order to enhance the absorption into the joint space, the joint needs to be opened up to allow the supplement to resurface the joint. And that was something done, it's a research done by one of the hospitals. They did that for 6 months. They see, under imaging, to see the joint actually resurface with the supplement. Okay. And I would like to say the reason why I joined this company. And actually, because the voice of Mr. Thomas, I came to the party on that day with the intention just to go visit the people who invited us there for 5 to 10 minutes and go home, because they said, what kind of business is being conducting at home? So when Tom was talking, I was not even looking at the information. I'm looking around, but actually his voice was so powerful to keep pounding the information in my head. And you already can see that. And after I saw the demo, I was so I purchased the product immediately because I've been using nutrient and supplement and mineral to help people, like it's from inside out. But I can see that there's another way we can do. We can actually help it from outside in. And the reason because it's very hard to get food nowadays that have the minerals to get into the body. And why mineral? Our body makeup of the 4 key elements is carbon, hydrogen, oxygen, and nitrogen. That's 96% of the body. But the mineral is only 4% of the body. But why is it mineral? Okay. Now, the average of the American life is about 77 years of age. And there is no study showing that people will die sooner. So when they're not taking the mineral. However, when we don't use mineral or supplement the later decade of our life, we have more disease and sickness. So that's why it's important to use these components. And also, mineral, enzyme, and vitamin, they work hand in hand. It's like a 3-legged stool. So you have one of them absent, it's very hard for the body to work. You can have, you don't have to have all the vitamins, but the mineral is critical. The mineral needs to be there to stimulate the enzyme to work in order for the body to absorb the nutrient into the body. Okay. So even the mainstream medicine acknowledges the importance of the mineral supplement. Example, the JMA, which is the American Medical Journal in December 24, 1996, there was a control study on one of the mineral, which is selenium, for the purpose for cancer patients. It was written the article last year, and the study was done that they have 1,312 people And it's a randomized study. They have some people take selenium, certain group of people take selenium, and certain group of people takes placebo. And they found that on the group that taking the selenium, 65% of the people, it reduced the prostate cancer by 65%, and it's reduced the lung cancer by 46%. So I just would like to share that information with you. Now, as far as the mineral that I use, there's some of the highlight I would like to share with you. Zinc, sulfur, selenium, and sodium. These are some of the important things, and also silicon. So zinc, being is a cofactor, is a cofactor for 80 different other enzymes, and it's a promote wound healing, it's tissue healing, and it keeps the skin healthy. Sulfur is the other one that also promotes protein synthesis, and also it is help to processing of the collagen when the tissue of the skin or the tissue of the body is injured. Selenium is one of the very important minerals that, because of the antioxidant, is a very powerful antioxidant. This is one of the ones that help people to reduce wrinkle and age spot, and it also stimulate or activate vitamin E to do that. The other one, silicon, is the one that when I watched the demo on the first day, and I was wondering it was silicon, and Dr. Ho confirmed that on the video that silicon actually, by utilizing the technology, they call nanotechnology, it will help to bring this mineral into the tissue. I want to use the example, the analogy to see the nanoparticle is something when you take, let's say like you take someone's hair and you split into 80,000 times. That's how small the nanoparticle is. So with that technology, it helps to bring the mineral into the tissue, the skin directly. And one other important mineral, I think, is sodium. It increases cells' life, and the other thing what it does is remove the toxins in the body of the tissue, so it keeps the skin to be healthy. Now, beside what I mentioned about the product of Seacret, I utilized recently. For the last month, I've been trying the product of Seacret to see how does that have a benefit on the patient that I've been treating, and we will show some slides on some of the patients that I used on. Okay, so this person, he actually had a fracture of the calcaneus, the bone at the bottom of his heel, in November, and he got a cast on. And I saw him recently, 2 weeks ago. I saw him recently. He's still very swollen every time he walked around. So he came to the office, and by that time, I had the Seacret product. However, a week before that, I used the oil salt for someone else that had a hand issue. So I'm out of that. So then I used the salt to mix with the lotion that we have, and apply onto his ankle. And I also utilize a certain kind of modality that I have at the office. And after 15 minutes, and as you can see at the bottom, on top, you see the swollen, and you don't see a lot of vein or vasculature on the foot. But after 15 minutes, you can see that the swollen came down, and you can see the vein on the foot better. Okay, this individual, I've been seeing her. I worked with her for the last about 10 years. She had certain kind of thyroid issue, and something affecting her where her hand and the skin always dry and crack all the time. So the first day when I saw her, I asked her to try these products. So when she put her hand into the oil, salt, she screamed. She took her hand out right away because it's burned, it's itched a lot. So I asked her to wash her hand and use one of the oils that we have. I don't know the name at this point in time, but once she used that, she feel better. She feels it doesn't have the burning sensation after that. Now, a week after, she came back. She said she want to try this salt oil again. And this time, when she put her hand into that, there was no burning sensation on the second week when I saw her. And actually, the crack on her hand, before I saw her hand, there's a lot more crack. And this time, on both top of her hand and bottom of the hand, barely see any crack. There's two small little cracks right below the ring finger on the right hand side there, and a little crack on the edge of the thumb there. But other than that, before usually have a lot more cracks than that.
That's in 15 minutes?
Yeah, 15 minutes. There's a couple of things I'd like to share with you that during this seminar I learned a couple of important words. One of them is the word but. I actually would like to replace that word with a must, And the other one is movement. That is the title of this convention. When in movement in Seacret, it creates wealth. And the movement in injury is create health. When I say create health, what it meant is that when a person has an injury, a lot of times they just take some medication or they do some treatment and they let it heal. But it's important to move, to exercise, to promote circulation, to bring the nutrient into the joint to help. And the same thing as a member of Seacret. In order to create wealth, we need to move. We need to act the movement. The last thing I would like to share with you is this individual. Linus Pauling. He is a very famous chemist and biochemist. He won two-time Nobel Peace Prize. And this is something that he said, like what we'd like to share with you. He said, you can trace every sickness, every disease, every ailment to mineral deficiency. Thank you.